Today, we're diving straight into a high-stakes medical scenario. This is one of those situations where just a few minutes can mean the difference between life and death, and where one single correct decision changes absolutely everything. Let's jump right in.
Okay, picture this. You're on the scene. A woman has just been stung by a scorpion, and the clock is officially ticking. Within minutes, she's feeling sick, her stomach is cramping, she's not making sense, and her blood pressure has just plummeted to a super dangerous 80/50. So, what is your very first move? What's the one thing you have to do right now?
To get to the right answer, we first have to put on our detective hats, right? We need to look at all the clues the patient's body is giving us and figure out exactly what they're telling us.
So let's lay out the evidence. We've got nausea and abdominal pain. Now that might sound kind of generic, but trust me, there are critical clues here. She's confused and her skin is pale. Those are classic signs that her brain just isn't getting enough blood. And that's all confirmed by the biggest clue of all, severe hypotension. That blood pressure of 80/50 tells us, point blank, she is in shock.
Now here's the curveball. When you and I think of a severe allergic reaction, what's the first thing that comes to mind? Hives, right? A big, itchy rash. But look at her patient's list of symptoms. There's no mention of a rash or swelling at all. So does that mean we're on the wrong track? Could it be something else entirely?
Well, actually, no. And this is so important. The absence of hives is one of the most dangerous red herrings in all of emergency medicine. Because even without them, we have more than enough evidence to make a definitive and life-threatening diagnosis.
This is anaphylaxis. It's a severe, life-threatening allergic reaction. And the key thing to get here is that you can be in full-blown anaphylactic shock from a known trigger, like our scorpion sting, even without a single hive on your body. You cannot let the absence of a rash fool you. It's a classic trap.
And this is exactly why we can be so sure. Let's just tick the boxes. We have a known trigger, the sting. The onset was incredibly fast. We're talking minutes. The nausea and abdominal pain, turns out they're actually super common symptoms. And most importantly, that confusion and plummeting blood pressure are screaming distributive shock. It all fits together perfectly. So we've solved the puzzle. We have our diagnosis. Now it's time to act. And in the middle of an emergency, there are a lot of things you could do, but there is only one thing you absolutely must do first. There's only one right answer.
And that answer is epinephrine. This stuff isn't just another medication. It is the silver bullet for anaphylaxis. It is the only thing that can fight the two biggest threats to our patient's life at the exact same time. It attacks the problem from two different angles.
So here's how it works. It's got this amazing 1-2 punch. First, through what's called its alpha-1 effect, it squeezes the blood vessels. That directly fights the shock and starts cranking that dangerously low blood pressure back up. At the exact same time, its beta-2 effect opens up the airways, making it easier to breathe. So it fixes the blood pressure and it fixes the breathing. It does both. And I really want this to sink in, because it's the most important takeaway here. It is the only medication that reverses anaphylactic shock. Nothing else on the planet works on the root cause of the problem this quickly or this well. So what's the plan? The order of operations here is non-negotiable. Step 1, before you do anything else, is give epinephrine right into the muscle. That's the fastest way to get it circulating. Only after that first dose is in and working do you even think about step 2, which is getting an IV started for fluids. That first shot is the bridge that keeps the patient alive. Now, I know what you might be thinking. What about all the other common allergy medicines? Antihistamines, like Benadryl, or steroids? They definitely have a role to play down the line, but giving them first is a critical and, honestly, a potentially fatal mistake. And this chart just breaks it down perfectly. You've got diphenhydramine or Benadryl. Sure, it helps with histamine, but it is way too slow and it does absolutely nothing to fix the shock. Then you have steroids. Great for inflammation, but they take hours to kick in. And something like ondansetron for nausea, all that does is treat the nausea. It won't touch the shock or the breathing problems. All of these can be helpful after epinephrine, but none of them are lifesavers.
So after going through the symptoms, the diagnosis, and all the different treatment options, this entire complex scenario really just boils down to one simple, unforgettable, life-saving rule. When a patient is in anaphylactic shock, everything else just fades into the background. There is only one priority. Not 2, not 3, just 1. And this is the line you should burn into your memory.
In anaphylaxis, epinephrine is the first, second, and third priority. Everything else can wait. So when it all comes down to it and you see someone in shock from an allergic trigger, what's the one thing that should pop into your head? You got it.